like to describe the REALIST study to you. I hope that you'll find it very interesting, as we did when we got to see the results very recently. So REALIST stands for Residual Risk, Lipids, and Standard Therapies, and it is 2 worldwide epidemiologic studies aiming to quantify the full extent of residual macro and microvascular risk associated with atherogenic dyslipidemia in patients with coronary heart disease or type 2 diabetes receiving standards of care. So the participating hospital centers, there are both centers that are participating in macrovascular disease. There are major cardiovascular centers, and microvascular, there are selected diabetes and internal medicine centers specializing in diabetology. And there are already 27 participating centers in 15 countries. So now I'll show you initial findings of the macrovascular study, and Dr. Fioretto will show you initial findings in the microvascular study. So the objective is to determine whether low HDL or high triglyceride are associated with a significant risk of coronary events in patients at or near goal for LDL cholesterol. The cases are selected from all hospital admissions, and they're adult male and female patients with a first or subsequent coronary event. That would be acute coronary syndrome, new onset angina, MI. And their LDL has to be below 3.4 millimoles. They can be treated with statin therapy and other drugs. The controls were patients hospitalized in the same time, free of coronary events, hospitalized for other reasons. The LDL levels also were less than 3.4, treated or not, with diet and drug therapy. And they are matched in a novel statistical technique by age, gender, diabetes status, and LDL levels matched to the cases. So here are the early results of this study. The patient characteristics, the cases are 170, the controls 175, and this represents all admissions to Brigham and Women's Hospital in Boston. That's where this initial study was conducted. All admissions from 2005 to 2008 of patients with these coronary events with LDL levels below 3.4 and having the required information available in the hospital record. So that's it. That's everybody. One thing I'll point out here is that the total cholesterol level was 3.6 in the cases, 4.1 in the controls. LDL cholesterol rather similar, 1.9 versus 2.2. HDL was 1.0 versus 1.2, and triglyceride 1.6 versus 1.5. Lipid-lowering drugs on admission, 48% in the cases, 26% in the controls. So here is the central result regarding triglyceride. So what you see here on the x-axis is the triglyceride in quintiles, and here are the odds ratio of coronary events associated with these triglyceride levels. So what you see is certainly an increase in the odds ratio at higher triglyceride levels, highly significant in this range of 133 milligram per deciliter to 190. In the highest triglyceride range, the risk was 2.0, a little bit of a decrease, and we think that is the effect of patients with very high triglyceride with chylomicrons, and that we'll be investigating in the full study. The most valid way to look at this, according to our statisticians, is simply to compute the increase in risk associated with each increase in triglyceride quintile, and that's 1.2. The odds ratio increase is 1.2, and the p-value is significant. Now, here are the central results for HDL, and what you can see here then is that as HDL increases, the odds ratio for a coronary event decreases. And again, the quintile analysis shows that the odds ratio decreases by 0.6, in other words, a 40% decrease in the odds of a coronary event with each quintile higher HDL level. So this demonstrates that high triglyceride and low HDL are highly significantly associated with coronary events in people who have LDL in the low range, who are treated for LDL. Now we looked at the combination of high triglyceride and low HDL, and I'd like to explain this. There has been this hypothesis that triglyceride is especially important in patients who have low HDL, sort of the atherogenic dyslipidemia concept, where you have both high triglyceride and low HDL. And there's also this idea that low HDL is more important when triglyceride is high. This idea has very rarely been tested in epidemiologic studies. And I get asked that question a lot when I give lectures to clinical specialists. So here we've looked at it, and my God, the results are kind of amazing. What you see here, I'll explain what this is. This shows this is HDL quintiles from high to low, and this is triglyceride quintiles from low to high. And the reference, or lowest risk category, this is the reference, is low triglyceride and high HDL. So what we have emphasized is a depiction of synergism. Okay, so what that means is you just walk right down the diagonal, and each further box in the diagonal represents higher triglyceride and lower HDL. Okay, so this is truly a demonstration of synergism, because as you walk down these diagonals, you see how the risk goes up from 1 to 1.3 to 2.0 to 4.1 to 10.2 for the odds ratio of a coronary event in patients who have the highest quintile triglyceride and the lowest quintile HDL. It's really quite amazing. And this is truly what we mean by synergism. Synergism is often a misused term. Synergism would mean that, synergism is, additivity is not synergism. Additivity is 1 plus 1 equals 2. Synergism is 1 plus 1 equals 3, 4, 5, 10. The sky's the limit. So this is truly a demonstration of synergism. In other words, with triglyceride and HDL together, we are in a non-linear space. Okay, so the initial findings then, in conclusion, really confirm these initial results. Well, we want to confirm these initial results in Boston globally in the REALIST study. It's very important to confirm the synergistic impact of high triglyceride and low HDL, and that could motivate new emphasis on lowering triglyceride and raising HDL cholesterol. And again, the later application would lead to new efforts to improve diet, increase exercise, lose weight, and could result in revising pharmaceutical strategies. Now, I'll make one point again that I didn't show the data here, but like Professor Osman, we found in these data that triglyceride became even more important in predicting coronary events in patients with low LDL levels. And the average LDL level in this study was about 75, so really quite low. And secondly, I'd like to say that you may have seen the MSD press conference, the results showing that patients on statin therapy, a lot of them had high triglyceride, about 40%, or low HDL, even on statin therapy. And what this study and the ProCamp study shows, it relates this kind of lipid levels to coronary events and shows the risk, the morbidity associated with these coronary events in patients with low LDL levels. So, thank you very much.